This is Dr. Elkhammas. Welcome back to these mini talks. Please feel free to leave me any critiques or comments. Thanks in advance. And I hope you'll be able to subscribe to the channel. Thanks. Today we'll talk about liver transplantation in adults. Liver transplantation is becoming really a routine procedure and a common procedure to treat end-stage liver disease. But probably as a medical student or a resident, you want to ask yourself why an adult person would need a liver transplant. Normally we have a liver that's really important to our body, that has a dual blood supply. It gets an oxygen or oxygenated blood from the hepatic artery as well as from the portal vein. It manufactures a lot of stuff in it and metabolize a lot of stuff in it. And in any case, if it's working well, the body is working well, we have functioning kidneys, functioning brain, and is being recognized as the largest organ in the body in the right upper quadrant. It's approximately about 1 to 1.5 kilograms. And it uses about 25% of the cardiac output. Major functions classified to maybe roughly into 3 categories: synthetic functions like albumin, metabolic functions like the bilirubin, drugs, food. It can store things as it stores vitamins. So when it's healthy, situation is so good. But when it goes bad and becomes cirrhotic, many things happen that are not desirable to the body and body function. So when the liver becomes cirrhotic for any reason, the liver tries to regenerate and repair itself, and at a moment it's going to fail doing further work or further repair. At this point, the blood flow inside the liver will slow down significantly, and the pressure, the back pressure in the portal system, where the blood comes from the stomach, the spleen, the pancreas, the small bowel, large bowel, become quite slow and congested. So the spleen become big, and it will start destroying red cells, white cells, platelets. So you get thrombocytopenia, you get leukopenia, you get anemia, you develop varices, you may bleed, you develop ascites, encephalopathy. So all these are the different manifestations for end-stage liver disease. They are outside of the scope of this presentation, but we'll talk about them in the future or in a different recording. And here in the United States, liver cirrhosis is really quite significant. It's number 8 as a cause of death. Approximately 40,000 people die a year, maybe even more. And most of the liver cancers occur in cirrhotic livers. So once the cirrhosis become symptomatic, and it is really usually one way. At the end of that way, either a liver transplant or death. So such patients usually are referred to hepatologists, and the hepatologist will deal with the symptomatic treatment and quality of life. And at one point, he or she have to determine if this person or this patient is candidate for liver transplantation, and if that's the case, they will refer him or her to a transplant center for evaluation. So when you look at the different diagnoses, that all of them result in advanced liver disease, and it's usually in form of liver cirrhosis. You see primary sclerosing cholangitis as one, and it's usually most of the time in the setting of inflammatory bowel disease, whether it's Crohn's disease or ulcerative colitis. primary biliary cholangitis, and that's the correct term. It used to be for many, many decades. It's primary biliary cirrhosis, but actually not many patients, or not all the patients develop cirrhosis. So the correct term is primary biliary cholangitis. Alcohol-induced liver disease, chronic hepatitis C, other viral hepatitis, autoimmune hepatitis, acute liver failure, whether it's from drugs or viruses or Wilson disease. All these are really common indications. And then you add to it lately, especially since 2002, an increased indication is the liver cancer. As you see the tumor here on CT scan, and the correct name for it is hepatocellular carcinoma. Sometimes it's done for non-cirrhotic disease, benign, like polycystic liver disease. And it's usually for polycystic liver disease, usually the liver functions are normal. However, it's done for symptomatic treatment such as gastric outlet obstruction. Non-alcoholic fatty liver disease also, and becoming rapidly increasing as an indication for liver transplantation, and it's also rising as an indication that it causes as a cause for acute on chronic liver failure, as a cause of hepatocellular carcinoma. Alcohol has, by the way, alcohol has two things. So it could present as alcohol-induced liver cirrhosis, or could present as acute alcohol hepatitis. And in either way, it is really quite significant. Probably about a quarter of the livers, they go to this diagnosis only. The acute alcohol hepatitis has been in from the 70s and 80s kind of controversial, but lately it became clear that it has high mortality, especially people who don't respond to medical treatment with the steroids. There are several models were developed to predict mortality, and early liver transplantation is being considered to save lives, and it's becoming really increasingly accepted indication in certain patients. And of course, once you have a liver transplant, you may come back for another liver. So re-transplantation is also another indication for liver transplantation, and re-transplantation for multiple reasons. The liver may fail. In this case, like you see, complete biliary obstruction. Liver transplantation, as you see in the 70s, about 18% of them, they survive a year, which is really quite dismal. Nowadays, in 2019 and 2020, we are looking at 93, 94% 1 year survival. And that didn't really come free. It came from many, many advances, medical care by hepatologists, tips, surgery, skills, training, anesthesia, antiviral, direct acting antiviral therapy for hepatitis C, immunosuppressive medications. All these things together really, nursing cares, pharmacists, multidisciplinary care, resulted in this impressive improved 1 year survival, and as actually even 3 year survival have improved. I put a few articles for selected readings, about 3 or 4 of them, but once you read them, you'll be able to look at the references and get more readings and so on. And at the end, I like to thank you for taking time and listening to me. I hope we'll record future videos for the same topic. Is really have not been completed. Liver transplantation is a wide topic. I hope you will like it enough to subscribe to our video channel, and bye bye for now.